going to be demonstrating the scapulothoracic release, sometimes called the shoulder block technique. And so you can do it just as a soft tissue kind of technique, but I really like to do a good myofascial release simultaneously with that. So to get, this is always a burdensome area. These parascapular muscles get very tight, very restricted. There's a lot of nerve network that is kind of going through the fascial network over here too. So if we're able to free that up with our hands, we can provide a lot of relief for our patients. And so I have them lay with the affected side up. I stand in front of them, I kind of lift the arm up, but just relax the arm down over me. Okay, so I got them nice and loosey-goosey. With my cephalad hand right here, I'm gonna help protract the shoulder blade. When I protract the shoulder blade, it allows me to kind of scoop underneath that inferior angle of the scapula and that medial border of the scapula. And I'm trying to kind of get my hand under here, so I'm trying to, again, use my hand to help protract that shoulder blade, which really allows me to scoop under there. And then I can kind of work on some inhibitory myofascial release. I can also start stacking the planes by moving into respective protraction, retraction. I can bring into abduction, flexion, extension, whatever I need to. And then I kind of slowly work my way up the medial border of the scapula, kind of again, not clawing, but trying to scoop my fingers in, trying to get that medial border of the scapula, really trying to get the rhomboids, as those are kind of very tight right over here, some aspects of the medial trap as well. And usually you can get the proximal or the distal 2/3 of the medial border of the scapula from this position right over here. After I'm done with that, then I will bring the arm up over here. Okay, so now it's up over here. I'm gonna put my hand over here, so I have my hand kind of on the inferior angle of the scapula now, and then my thumb actually, if I kind of work on it myofascially, I can actually get down to a little bit of the latissimus as well as the subscapularis. And so I can do a little bit of release on that tissue with my thumb that I'm doing right over here, but I also have control of the scapula with this hand. So this hand is multifunctional. Okay, so I'm gonna kind of get down over here so I feel myself kind of going through the lat, getting onto the subscapularis, and then simultaneously trying to get to that superior angle of the scapula right over here. Trying to release that tissue, notably the levator scap as it comes up onto that superior border of the scapula on the medial aspect here. That tends to be a very high yield area. And I do what I can just to kind of release that tissue. Not dragging on the skin, but getting down to the fascial level, okay? And so that's the shoulder block technique.